Until we reach immunity, we're all at risk of catching COVID-19, but some are at greater risk. COVID-19 is often severe for those who are over 60 years old or for those who have underlying conditions like lung or heart disease, as well as diabetes. Today, there are new variants of COVID-19 that are even more infectious, leaving them even more vulnerable. This episode of MedTalk Health Talk is dedicated to creating better awareness. If you're at high risk, learn what you need to do. Know what measures you should take to protect yourself. But if you're not in the high-risk category, do your part to protect them. I'm Dr. Freddy Gomez. You're watching CNN Philippines. Certain people are at increased risk of serious illness if they catch COVID-19. And more than a year into the pandemic, what are the tried and tested ways to keep them safe? Our guests are here today to guide us in protecting these high-risk groups. With us is Dr. Ronald Fajardo. He's an interventional pulmonologist at St. Luke's Medical Center. We're also joined by Dr. Guido David, an Octa Research Team Fellow and Professor at the University of the Philippines. Thank you both for joining us. Now, let's start off by identifying these high-risk groups. Dr. David, tell us, who are they actually?
We have the age demographic 65 and older. Based on previous data, we're seeing a case fatality rate of almost 13% for this age group, 65 and above. So that means about 13 out of 100. And for 60 to 64, we were seeing about a little over 6% case fatality rate. And for the 0 to 55 age group, a much lower case fatality rate of less than 1%. Although we have been seeing a sort of an increase in case fatality rate due to the recent surge. For example, the 65 and up age group, the case fatality rate has increased slightly to about 15.6%. And for the 60 to 64 age group, it increased slightly to 7%.
So you're at high risk if you're above 60 years or have another health problem. But many of you may be wondering, what does high risk mean? What are the consequences for these people? Dr. Fajardo, can you please explain?
So those who are considered as those are high risk for having severe or critical COVID disease are those who are elderly, those who, as mentioned, having an age of more than 60 years old, and those who have having comorbid conditions or those with diseases, okay, that are unstable. So what are these diseases? This can be those with respiratory problems, such as those having asthma, those who have COPD or emphysema, those who have diabetes, and those who have uncontrolled hypertension, even those who have malignancies and other diseases that would say that the patient is immunocompromised or those who have a weak immune system.
Now, around the globe, the elderly have faced many challenges brought about by the pandemic. Their weakened immune system and potential chronic conditions put their physical health at risk. And the quarantine restrictions have affected their mental health this time. Now, let's talk about how we can best care for them. Let's start first with their diet, because healthy eating is important at any age, but even more so as we get older. Dr. Fajardo, what is a healthy, well-balanced diet for our seniors?
Having a healthy diet, it would involve, of course, what we have usually known, that having more of eating the vegetables and the fruits, having more of the rich sources of the vitamins and the minerals, less of the fatty food, and less of the salty food. Okay. Besides having a good diet, it's also important that they should have regular exercise, just even low impact exercises that would greatly benefit the immune system of these immunocompromised people.
Yes, also staying hydrated is equally important, and experts recommend drinking around 15 cups a day for men and 11 cups a day for women. And practicing physical activity, as Dr. Fajardo mentioned, is another way to keep the elderly healthy. But with the quarantine restrictions, this has proven a little bit more challenging. Now, Dr. Fajardo, what are practical ways that older adults can stay fit?
Okay, so the practical ways that they can stay fit is, of course, to do even passive exercises, even when they are at home, no? Because we are in a lockdown, so they are not allowed to go out, but they can still do exercises on their own, no? In their backyard or even inside their houses. No?
Dr. David, COVID-19 cases are constantly rising despite the restrictions imposed. What could be the reasons for this?
In fact, based on the latest data that we're seeing, the average number of cases in the NCR is, for the past 7 days, is less than 4,000 cases per day now. So although the trend is still unstable and sometimes cases are still rising, the overall trend is now reversed to a downward trend. What we're seeing is a negative growth rate of about 21%. But this is an effect of the community quarantine that we had, the ECQ, and almost 2 weeks of MECQ.
There's so much data available now for everyone to look at, and a lot of people may be confused. What should they look at?
We should be looking at the number of cases per day, but the trend is indicated by the reproduction number and also by the positivity rate. What we want is to reduce the number of new cases per day, and eventually this will allow the number of hospital admissions to reduce, because right now hospitals are still full.
Okay, very good information. And aside from looking at the number of cases per day, remember, always practice social distancing and never social isolation. But other factors can also increase your risk of catching COVID-19, and among them, heart and lung conditions, two of the more common diseases in the country. We'll discuss this after a short break. Stay with us on MedTalk Health Talk, your partner in healthcare, only here on CNN Philippines. Today, we're talking about high-risk groups when it comes to COVID-19 and how best to protect them. You're watching MedTalk Health Talk on CNN Philippines. I'm Dr. Freddy Gomez. There are people who are more vulnerable to serious illness from COVID-19. Dr. David, what are the factors that affect the rise and fall in the number of infections so people, including the high-risk groups, would know about to be more cautious about it?
We know about the virus is that it's primarily airborne. Anytime we can prevent transmissions through aerial droplets, we should take steps in preventing airborne transmission. So what that means is, of course, wearing face masks is important, but in public places, it's important for us to keep our social distancing.
The point to get here is COVID-19 is easier to transmit and be infected with now than what was originally thought. And one of those that need to be protected, of course, is our lungs. And chronic obstructive pulmonary disease is actually among the 10 leading causes of mortality here in the country. Dr. Fajardo, can you tell us what this is and how does COPD increase the risk of COVID-19?
Since COVID-19 really enters through our body primarily through our airways, healthy lungs have a fighting chance of fighting it off. But if you have what we call respiratory diseases such as COPD or what is commonly called as emphysema, then the resistance of that person is lower as compared to a healthy individual. So the virus can easily attach to your lungs and easily infect that person. So the COPD or particularly other kinds of respiratory diseases such as asthma or those who call chronic bronchitis, all these conditions predispose a person to having a more severe type or more critical type of COVID-19 disease.
It's good that you mentioned the asthma, Dr. Fajardo, because a lot of Filipinos do suffer from asthma, and there have been many studies on the relation between asthma and that of COVID-19. So my question is, Dr. Fajardo, how does asthma increase the chance of severe illness from COVID-19?
Before the COVID-19 pandemic virus, having asthma predisposes you to having other types of infection, particularly the viral infection. And whenever an asthmatic would have a viral infection, they would have what we call exacerbations or difficulty in breathing. So this is similar since a COVID-19 is a virus, no? And that person will also have a viral infection. The asthmatic would have an exacerbation or have difficulty breathing.
Yes, and another chronic lung disease that may make you more susceptible to COVID-19 is pulmonary hypertension. It's a type of high blood that affects the arteries on the side of your heart that brings blood towards the lungs. Now, Dr. Fajardo, how are those with pulmonary hypertension at increased risk of COVID-19?
Patients who have pulmonary hypertension already have problems in the delivery of oxygen in their system. And this is because, as was you mentioned earlier, Dr. Freddy, that there's like a high blood hypertension or high blood already in the arteries or in the veins that's going to the lungs, and there's already a problem in the oxygen delivery. And if you have a COVID-19 pneumonia, there would be a decrease in the amount of oxygen that's already being absorbed by the lungs, then there would be an increase or more severe type of difficulty of breathing because of the less amount of oxygen that would be delivered to your body.
Now, if you have a chronic lung disease or living with someone diagnosed with a lung disease, remember, keep taking your prescribed medications. Always make sure that you are well stocked with your maintenance or those types of medications. Follow minimum health standards. And if you start to notice new symptoms or experience a flare-up of your lungs, please consult your doctor as soon as you can. Now, if you're living with a heart condition, you must take extra precautions. Dr. Fajardo, please explain the consequences for someone with a heart condition catching COVID-19.
Having a heart disease by itself is also one of the immunocompromising condition. If that patient is not compliant with medication or doesn't take any medications, or his blood pressure is uncontrolled, or those who are having coronary artery disease, or those who are having plaques or atherosclerotic disease, these are all pro-inflammatory state. And having another infection on top of this pro-inflammatory state would produce a more severe type of infection and more severe type of reaction from the COVID infection.
Okay, through all this, our viewers will definitely know that it is very easy to have complications if you have any of these pre-existing conditions. Now, Dr. David, with the current reproduction rate, how do we reduce the vulnerability to the virus? What are some of the ways?
We must always look out for preventive ways in order to avoid getting the virus, especially to the elderly and the vulnerable population. What's happening right now is most of the people, having access to, going outdoors for work are the people aged 18 to 55, the working age group, but their risk for mortality is very low. As we mentioned, it's probably less than 1%. So the problem is that when some of these people, when they get home, they live with people with comorbidities or people with higher ages. So that puts these people at risk of catching the virus that the working age people may get. So we must find ways to shield these people, the elderly and the vulnerable population, from catching the virus from people in the same household who have to go out and work. So we could explore ways for, maybe isolating them from members of the same household, or at least maybe even wearing face masks when people are together at home.
If you're not feeling well, isolate yourself and talk to a doctor. Find out from your barangay what the safety protocols or requirements are, and if you test positive for COVID-19. Meanwhile, more about those who are at high risk, like diabetics, after a short break. Our goal here on the program is to keep you on the path to good health. You're watching MedTalk Health Talk on CNN Philippines. If you're above 60 years or living with a disease, the impact of COVID-19 can be more serious. We're here to help you take the steps to protect yourself. I'm Dr. Freddy Gomez. This is MedTalk Health Talk, your partner in healthcare. Diabetes is the 6th leading cause of deaths among Filipinos. And with the added threat of COVID-19, this makes diabetics even more vulnerable. Dr. Fajardo, can you tell us what is the impact of COVID-19 on those with diabetes?
Diabetic patients are themselves immunocompromised because the elevated blood sugars suppresses the immune system. They are very much prone to all kinds of infection. It might be bacterial, fungal, or even viral infection. So their immune response from these invasive pathogens or those that cause disease is very low. So they are very much prone to acquiring all of these types of infection, not just the COVID-19 virus, but also the bacteria and the fungus. And usually it is very common, not all, but very common even among diabetics to also be in the overweight or those who have more weight, and being having more fats or having more adipose tissue in the body is also one of the what we call an inflammatory state. And since COVID-19 infection produces an inflammatory response to the body, having a baseline inflammatory state and compounded with having this infection and having more inflammation would again produce a more severe type of disease or a more severe type of pneumonia.
And knowing that, Dr. Fajardo, knowing that about diabetics, how can diabetics best prepare for quarantine or even isolation? What should they keep in mind or what should they have on hand in case of an emergency?
So it's very important. They should be very compliant in their medications. Targeting the normal blood sugar range is very important to have a better immune response against any types of disease. And even if they're in quarantine, it should be important that they should practice good lifestyle and they should not just eat a healthy diet, they should also exercise.
Right, and these high-risk groups face the most threat during this pandemic, and we should do our part to ease the burden on them. The high-risk groups include people who are older than 60 years and those with underlying conditions. Dr. David, let's remind our viewers, what does it mean for this group to be severely ill from COVID-19?
These age groups are actually at high risk for severe or critical form of COVID-19. And that would entail or require hospital care for a significant portion of these cases who belong in this age group. So definitely people in these age groups who are with comorbidities have a high risk of being hospitalized.
Okay, now if you're at high risk, protect yourself. Don't put yourself in a position where you can catch COVID-19. And if you're not, do your part and prevent the spread. Now, Dr. David, what are the 3 C's of transmission? Just to remind our viewers again.
Yes, the 3 C's are avoiding crowded places. This relates to basically social distancing and wearing face masks. Basically, these are the steps that we take to reduce the risk of getting the virus in public areas.
Right. So those are the crowded places, your close contact settings, as well as confined and enclosed spaces. And avoiding these 3 C's is your key in curbing the spread of COVID-19. I'd like to thank interventional pulmonologist Dr. Ronald Fajardo and Octa Research Team Fellow and Professor Dr. Guido David. Thank you very much for joining us today. We appreciate your time and your knowledge very much. We're here to help build a healthier future for you. I'm Dr. Freddy Gomez, and thank you for watching MedTalk Health Talk on CNN Philippines.